So if my hand is the diaphragm, then heart is placed like this, right? For example, that this is the apex of the heart, right? This is the apex of the heart, which forms the left side, right? This is the left border of the heart, this is the right border of the heart, and this is the base of the heart, right? This is the right atrium, present on the right side. This is the right ventricle, and on the anterior lateral side there is the left ventricle, right? Right atrium, right ventricle, anterior lateral side, this is the left ventricle, right ventricle, and between the left ventricle there is the anterior interventricular groove, right? And this is the anterior surface of the heart, right? So anterior surface is mostly occupied by the right ventricle, and anterior lateral surface is occupied by the left ventricle, and the right side is occupied by the right atrium, and there is a groove, that is the atrioventricular groove, right? This is the right ventricle, and this side there is the left ventricle, and between the right ventricle and the left ventricle there is the posterior interventricular groove, right? On the upper side of the posterior surface, this is the posterior surface of the heart, and this is the inferior surface of the heart, right? On the posterior surface there is a presence of the left atrium, right? There is a left atrium, and this is the inferior surface, there is a posterior interventricular groove is there, right? Because at there the posterior interventricular artery is running, and this posterior interventricular artery gives septal branches, marginal branches, right? Inferior border branches, right? And there is the AV node, so this posterior interventricular artery supply the AV node too, and there is in the right atrium, there is the SA node also. This SA node is supplied by the, basically in the aorta, right coronary artery is come, this right coronary artery from the superior vena just around the superior vena cava supply the nodal branch. So sinus bradycardia, AV nodal block is due to the right coronary artery block, right? Left coronary artery runs inside this groove, between this groove and also